ticagrelor monotherapy versus ticagrelor with aspirin on major bleeding and cardiovascular events in patients with acute coronary syndrome, the TICO randomized clinical trial. In the TICO randomized clinical trial, stopping aspirin was tested as a bleeding reduction method after short-term dual antiplatelet treatment. However, ticagrelor monotherapy has not been studied in patients with acute coronary syndrome solely. The objective of this study was to determine whether moving to ticagrelor monotherapy in patients with ACS treated with drug-eluting stents after 3 months of DAPT lowers net adverse clinical events compared to ticagrelor-based 12-month DAPT. This randomized control trial was conducted in 3,056 patients with ACS treated with drug-eluting stents between August 2015 and October 2018 were included in this trial. A total of 1,527 patients were randomized to receive ticagrelor monotherapy 90 mg twice daily after 3-month DAPT, and a total of 1,529 patients were randomized to receive ticagrelor-based 12-month DAPT. The primary outcome assessed was a 1-year net adverse clinical event defined as a composite of major bleeding and adverse cardiac and cerebrovascular events such as death, myocardial infarction, stent thrombosis, stroke, or target vessel revascularization. After out of a total of 3,056 patients who were randomized, only 2,978 patients completed their trial. The occurrence of primary endpoint happened in 3.9% of patients receiving ticagrelor monotherapy after 3-month DAPT and in 5.9% of patients receiving ticagrelor-based 12-month DAPT with the hazard ratio of 0.66. After 3 months of DAPT therapy, major bleeding occurred in 1.7% of patients with ticagrelor monotherapy and in 3% of patients with ticagrelor-based 12-month DAPT with a hazard ratio of 0.56. No major difference was observed between the incidence of major adverse cardiac and cerebrovascular events between the ticagrelor monotherapy after 3-month DAPT group and ticagrelor-based 12-month DAPT group. The results of this study demonstrates that among patients with acute coronary syndrome treated with drug-eluting stents in comparison to ticagrelor-based 12-month dual antiplatelet therapy, ticagrelor monotherapy after 3 months of dual antiplatelet therapy caused significant reduction in composite outcome of major bleeding and cardiovascular events at 1 year.